And then we're going to talk about women's health. We have a lot of topics to cover this morning, including hormones, the evolution of women's health care, and long-term dangers of certain prescription drugs. Stay with us. Well, women's health has come a long way over the years, and here to talk to us about a few current issues is Dr. Hotze. He is the author of Hormones, Health, and Happiness, a natural medical formula for rediscovering youth with bioidentical hormones. It's quite a mouthful. Good to see you, Doctor. Thanks so much for being with us.
It's a pleasure to be here, Catherine.
Okay, so would you say the key to finding our youth and to our health is through this bioidentical hormones?
Exactly.
Well, what are they?
Well, bioidentical hormones are the same molecular hormones that your body or a man's body makes in adequate amounts when they're younger. But as we mature, our hormone levels decline, just kind of like ground moisture declines in the summer in Texas before we get a good rain. And the hormones are the chemical messengers that tell our cells what to do and how to do it. And when those hormone levels decline, we experience a host of problems, and those occur commonly in midlife. And
what are some of those problems that women face?
Fatigue, difficulty with weight, inability to really focus and feel sharp mentally, depressed moods or panic attacks, inability to sleep well, joint and muscle aches and pains, sluggish bowel function, hair falling out, cold hands, cold feet, generally loss of romantic moods and inclinations, just a general decline in their health, which they learn to kind of live with, but as things get worse, they ultimately end up at the doctor's office. Unfortunately, the doctor, while he may say, this is due to your hormones, the treatment is often drugs.
Well, we've heard a lot about hormone replacement therapy and the buzz surrounding that.
Well, there's two types of hormone replacement therapy. Counterfeit hormone replacement therapy, which the pharmaceutical companies do. They give you hormones or drugs that mimic hormones because they can patent those and charge exorbitant fees. Or you can use bioidentical hormones, hormones that are identical to the hormones your body made. They're chemically formulated in a lab by pharmaceutical companies, but they're bought in bulk by compounding pharmacies, and they are prescribed. The physicians that are trained in bioidentical hormone therapy have to be a medical doctor. You have to get a prescription, and then those are supplemented. Now, the bioidentical hormones would be primarily in young women that are premenopausal, would be progesterone, natural progesterone, at 15 through 28. Also, thyroid is very important. And we don't recommend the synthetic thyroids because, in our experience, they don't work well in our guests that we've seen. We use armor thyroid. Hypothyroidism is a commonly overlooked problem that many women know they have. They tell their physicians, but their blood tests come back normal, and the physician says, honey, we're just going to put you on a little antidepressant. Good luck. And that's the way it goes.
So you think there's a lot of misdiagnosis?
Absolutely. Then? Tremendous amount of misdiagnosis. And that's because the drug companies send the sales reps in stacking up antidepressants on the shelves, and that's where and they train doctors to give women who have a host of complaints antidepressants.
You said when you went to medical school you were trained in the school of thought to just give drugs.
That's right.
And you say that you're going against that.
Well, that's right. I went to University of Texas Med School in Houston, and I was trained as an allopath. That's a medical doctor. You're trained to give a drug for a problem. And I tried that, but there was a little lady came into my office in 1988 that changed the course of my life and our patients. And I said, how are you doing, Ms. Jones? And she said, Dr. Hotze, ever since I threw away all the drugs you're giving me, I feel like $1 million. And the drugs, and what they don't teach you in med school is all these drugs have significant side effects. Some are much worse than the original problem, and they don't address the underlying cause. All they are is like a Band-Aid on a problem. And that's unfortunate for so many women because they can be helped naturally by simply replenishing and balancing their hormones, and also by using natural thyroid supplementation.
Obviously, you've done research on this.
I have. And
extensive.
I have. And that's why I wrote the book. I wrote the book, Hormones, Health, and Happiness, and I have a copy for you, too. This is for you. But
okay, great.
I wrote this book to give women hope in midlife, that they don't have to accept the male-dominated male profession's idea that they're hypochondriacs or they don't think clearly and they just need to be drugged up. I don't think that's right. I want to help women, and that's what we're touring the nation doing.
Well, you can get more information in his book about bioidentical hormones. It's very interesting. Doctor, thanks so much for stopping by.
Thank you. It's my privilege.
We appreciate it.
Thank you.